Surgical management of atrial septal defect, ASD, involves procedures aimed at closing the defect to prevent complications such as right heart enlargement, heart failure, arrhythmias, and pulmonary hypertension. The choice of surgical approach depends on the type, size, and location of the defect, as well as the patient's overall health and the presence of symptoms. Here's an overview of the surgical management options for ASD. Percutaneous transcatheter closure. This minimally invasive procedure is typically used for secundum ASDs, which are centrally located and have adequate rim tissue around the defect for device attachment. It is often the preferred method in patients with a suitable anatomy. During the procedure, a catheter is inserted through a vein in the groin and guided to the heart. Using imaging techniques like echocardiography and fluoroscopy, a closure device is delivered to the site of the ASD. The device is deployed to span the defect, where it expands and seals the hole by promoting tissue growth around the device. This approach is less invasive than open heart surgery, offers a shorter recovery time, and can often be performed on an outpatient basis. Open heart surgery. This is necessary for ASDs that are not amenable to percutaneous closure, such as large secundum ASDs, primum ASDs, sinus venosus ASDs, and cases with associated congenital heart anomalies. The patient is placed on cardiopulmonary bypass during the surgery, where the heart is accessed through a median sternotomy. The surgeon closes the defect using either direct suture closure for small defects or patch closure for larger ones. This approach is effective for all types of ASDs, allows for the addressing of associated defects, but involves a longer recovery time and greater risks associated with open heart surgery. Minimally invasive surgery. This approach is similar to open heart surgery but performed through smaller incisions, often using robotic assistance. It is suitable for patients with a preference for less invasive methods, but who are not candidates for percutaneous closure. Access is gained through small incisions, and the ASD is closed using similar techniques as in open heart surgery. This approach offers the benefits of smaller incisions, less pain, and a quicker recovery. Hybrid approach. This combines surgical and catheter-based techniques used in cases where a pure percutaneous or surgical approach is not ideal. The defect is accessed surgically, and then a device or patch is delivered via a catheter-based approach under direct surgical visualization. This method is useful in complex cases, combining the benefits of both techniques, but involving the risks of both surgical and catheter-based procedures. Postoperative care and follow-up recovery time varies depending on the type of procedure. Regular follow-up is necessary to monitor for complications such as residual shunts, arrhythmias, or device-related issues. Patients may be prescribed anticoagulants, antiarrhythmics, or antibiotics postoperatively. Summary. Surgical management of ASD is tailored to the specific needs of the patient, with options ranging from minimally invasive percutaneous closure to more invasive open heart surgery. The goal is to effectively close the defect, alleviate symptoms, and prevent long-term complications. The choice of procedure depends on the defect's characteristics, the patient's overall health, and the surgeon's expertise.